Want to know why everyone's talking about Ozempic and the most recent side effect that has the FDA concerned? Then stick around and I guarantee you'll learn something new. If you do, make sure to like, share, and subscribe. Semaglutide, otherwise known as Ozempic or Wegovy, was originally a diabetic medication designed to help reduce blood glucose levels and decrease the risk of cardiovascular disease. In 2021, semaglutide was approved by the FDA to treat obesity by promoting weight loss. It is branded as Ozempic for treatment of diabetes, or in higher doses as Wegovy for weight loss. Semaglutide is in a class of medications called glucagon-like peptide 1 or GLP-1 analogs. GLP-1 is normally released by the small bowel. GLP-1 binds receptors on pancreatic beta cells and stimulates the release of insulin. Remember, in diabetes, there is insulin resistance and a decreased insulin release in response to glucose. GLP analogs stimulate beta cells of the pancreas to increase the amount of insulin produced, helping reduce blood glucose. In addition, it inhibits the inappropriate release of glucagon. GLP-1 analogs help control blood glucose by stimulating insulin release and by inhibiting inappropriate glucagon release. As a side effect of its mechanism, GLP-1 analogs delay stomach emptying, which leads to feeling full quickly. As a result, individuals eat less, leading to weight loss. Ozempic and Wegovy are once-weekly injections that, when taken, cause a feeling of fullness, so as a decreased drive to eat. In 2021, the STEP program completed its Phase 3 trial. STEP stands for Semaglutide Treatment Effect in People with Obesity. For transparency, it should be noted that this study was sponsored by Novo Nordisk. This study included 1,961 adults with a BMI of 30 or greater, and those with a BMI of 27 or more, but who also had an obesity-related condition, like diabetes, hypertension, or coronary artery disease. The participants were split into two groups. Both groups underwent lifestyle interventions with coaching and exercise. One group was given semaglutide 2.4 milligrams once weekly, and the other group was given placebo. The two main endpoints were the mean percentage change in body weight and percentage achieving a 5% weight reduction or more. The study showed that at 68 weeks, the mean change in body weight was a loss of 14.9% of body weight in the semaglutide group, versus a loss of only 2.4% in the placebo group. In addition, semaglutide resulted in 86.4% of participants achieving a 5% or greater reduction in body weight, versus only 31.5% in the placebo group. The significant difference between the semaglutide group and placebo is also seen when looking at those who lost more than 15% body weight. 50.5% lost more than 15% of their body weight with semaglutide, while only 4.9% lost more than 15% with placebo. The benefit of semaglutide over placebo was also seen with improvement in high blood pressure, cholesterol, and hemoglobin A1C. But what happens when semaglutide is stopped? An extension study was completed after the STEP trial. A portion of the original group of participants stopped both lifestyle interventions and semaglutide. At 52 weeks after stopping semaglutide and lifestyle changes, those in the semaglutide group gained 11.6% of their body weight back, while those in the placebo group gained 1.9% back. The net result was a 5.6% net weight loss after 68 weeks being on semaglutide, and then 52 weeks off the medication. In addition, the cardiometabolic factors like blood pressure, cholesterol, and hemoglobin A1C returned to their baseline after being off the medication for 52 weeks. While Ozempic is a great aid in weight loss, it needs to be used thoughtfully and monitored carefully. The STEP trial highlighted that Ozempic can cause symptoms like nausea and diarrhea. These side effects resulted in 4.5% of participants of the original study discontinuing treatment versus only 0.8% in the placebo group. In addition, because it stimulates the beta cells, it can cause pancreatitis, and if this develops, Ozempic or Wegovy should be discontinued. More recently, The American Association of Anesthesiologists has issued a warning with medications like Ozempic. Because GLP-1 agonists cause delayed gastric emptying, the concern is that patients may have food in their stomach despite having nothing to eat prior to surgery. This could significantly increase their risk of aspiration or stomach contents entering the lungs, resulting in respiratory issues. Though we still need more data to understand how to manage GLP-1 agonists prior to surgery, the current recommendation is to hold these a week prior to surgeries. There is some data that suggests delayed gastric emptying is short-lived and wears away with time, but further research is needed. More recently, the FDA has released a warning that intestinal obstructions have been reported with Ozempic. Though it's not clear how often these side effects are occurring or if they're truly related to the medication. Nonetheless, Ozempic or semaglutide remains an incredible medication that is a great weight loss aid when it's taken with a healthy diet and regular cardiovascular exercise. Well, I hope you learned something new about Ozempic, and if you did, give us a like, share, and subscribe. Remember to keep learning, and I'll see you next time.